if we can provide assistance to families that need additional support in an area that we don't provide here, then they're going to be better equipped to come to school and get more out of what we're offering as an educational institution.
We truly understand as educators that we cannot begin to teach without having well bodies, sound minds, and students who are physically fit to come to school.
So having the mental health collaborative really supports the students in that aspect.
Our goal is to address any trauma, behavioral issues, depression, anxiety, or any of the related disorders that are posing as barriers to the child's academic achievement and overall well-being.
Everything just hit me all at once, and that affected me in school. I didn't feel like coming to school. It was a drag to even get out of bed, and I decided to get help here, and now I have motivation to do work, to do homework, and to succeed.
When students receive services from the Health Collaborative, they tend to flourish.
I wasn't myself a lot, and I asked my aunt if I can come and talk to someone, and ever since then I've felt very happy about myself, and it actually had boosted my grades now. At first I was, a B, C student, and now I am currently a straight A student, and I hope to stay like that.
The Lynwood Unified School District's Health Collaborative was organized several years ago, and it's comprised of a number of health agencies, which include medical services and mental health services for our students and their families.
In the Lynwood School District, MASADA Homes provides mental health services, which includes individual, family therapy, group therapy where appropriate. Every child that we service, we measure outcomes because as part of the treatment plan, we create goals. So we actually are able to create quantitative data to be able to measure the progress and success of treatment.
When students are more emotionally stable, they're more ready for school, and the graduation rates have increased.
We're very comprehensive here. They don't have to pick and choose what they need. So we offer adult and pediatric services, annual screenings, immunizations, preventive health care like pap smears and STD screenings. We have annual immunizations, diabetic screenings, high blood pressure, you name it.
We have enrolled over 700 families in health insurance during the past year. This has been a tremendous accomplishment because most of these families have never had health insurance coverage.
It was a confluence of effort. It was putting all of these different agencies in the room and making sure that we had clear, defined roles and responsibilities about how everyone would operate. Most of the agencies that we partnered with bill through Medi-Cal, so there is no direct cost to the district for these services. The budgetary items for us have been primarily in-kind and making sure that we provide subtime, provide professional development for our staff to make sure that they understand what those early warning indicators are so that they can make the appropriate referral to the agencies that each respective school is working with.
The ways we find out that students need help, they're not always easily indicated. It can be through body language, it can be through poor attendance, but most of the time it's just meeting with your students. Sometimes you can never tell. Just by looking at them.
This year I sent out about 25 referrals, which is about 5% of my caseload. Once the student is in treatment, we do follow up with the student and the therapist as well.
To be able to pair up over 800 kids with health services that we take for granted, that it's done remarkable things.
Now I am different. Now I am better. I want to make a change in the world.